So for the third time this week, I have had someone ask me about what can they do for exercise when they have knee pain. And typically you would think, okay, I get knee pain and like I have to stop everything, but that is not true. So I'm going to give you the same advice that I gave them on what's going on and what you can do and how you can cope through exercising with knee pain. So first things first, what is going on? So knee pain, it could be a couple of things. It could definitely be something that's like osteoarthritis or just arthritis. You could have where your patella, because here's the deal. Your knee is like, it's your patella. It may be like, actually, maybe like that big. Believe me, I studied osteology. I have seen a lot of kneecaps. So it's about like that big, and it is held in place by ligaments, and then of course your muscles help to hold them in place. So that's what's going on with, it's just this part that's your kneecap. However, if there is arthritis that's a part of it, then your femur and your tibia can start rubbing together. That's what causes some of the arthritis. And it could be that your patella, like the kneecap itself, is like off-centered, so it's not tracking properly. That can cause knee pain. And then it could also just be as simple as something like what they call jumper's knee or runner's knee, which is where you're having inflammation or scar tissue that's going on with one of your ligaments. Okay. Whew, I feel like all tongue-tied with this. You know, if this was a video, this would already be erased. So that could be what's going on. There's a lot of different things. So first things first, you have to figure out, what do you do about it? You got to go to your doctor first. Nothing's going to happen until you go to your doctor. Your doctor's going to put you through the typical thing. They're going to take x-rays, which won't show them very much unless you have like something going on, like a stress fracture or something like that. Then it can show that, but it's not going to show anything that's going on soft tissue. That is where you have to have an MRI. Doctors are very hesitant to give MRIs. I guess it's expensive. I don't know, but they want to go through this series of stuff before you actually get an MRI. So they're going to give you anti-inflammatories, and then they'll also suggest physical therapy. Physical therapy is great. However, sometimes that doesn't necessarily take care of it'll address what's going on there, but not like tackle the entire problem. So it's just kind of like fixing one part of it without fixing everything that's going on with your body, because the reality is your body is a kinetic chain. So it is a chain. So you could have something going on with your knee that's coming from something going on in your hip. You could have something even being thrown off by your ankle that will, rotate things differently and can throw your knee off track, and that can all cause knee pain. But first and foremost, you still want to go to the doctor. You got to go through jump through all of their little hoops, and then maybe they'll give you an MRI. So what I've been advising people to do is absolutely go visit their doctor, get that whole thing done, but then also to go the route of, you don't necessarily need surgery all the time, So what I suggest is that they go to a chiropractor, a very well qualified chiropractor, and do know that chiropractors don't always have to like pop you. Like there are other ways that they can adjust without doing all the cracking of the bones and stuff like that. But what a chiropractor does is that they will put you in skeletal alignment with how your body is supposed to be. Now, the issue with that, and where people think that chiropractors are a bunch of BS, is because like your muscles are used to doing this thing. Like maybe you're used to like walking around like this, right? And so then the chiropractor fixes you, but your muscles are like, no, like I'm used to being like this. And so it just jacks everything up. So they will put you the way you're supposed to be, but your muscles, because they've been doing this thing for so long, they're gonna knock you back. So that's where you can get into the endless cycle of getting adjustments, which does not help your problem. So I'm just going to say that. But I do advise everyone start off with a chiropractic adjustment, because it's going to put you the way that you should be. That at least provides you with some structure. After that, the biggest person and the most important person on your team is a massage therapist. You want to have a massage therapist that knows how to do neuromuscular or trigger point massage. That's different. You don't need people to rub lotion on you. You can get a significant other or pay someone to do that. You need actual therapeutic massage where they're getting deep into your fascia, getting deep into your trigger points to release those trigger points so that your knee can, the muscles can support the way that your skeleton or your structure is supposed to be. You could go see the chiropractor once and then move on to where you're seeing the massage therapist once every 2 weeks. That's a good thing. Now, that's not the end of the story. The end of the story comes with two things. One, foam roller, because you're going to have to do some things on your own. You're not going to get away with this with just going to a chiropractor and massage therapist. You do have to do some work. So this is an example of a foam roller. Typically, where you're going to have to work, let's see, y'all. So typically where you're going to have to go is about right there. Most knee pain, especially if you feel it in your kneecap, is coming from this part of your quad. Now, if you have knee pain on the inside of your knee, then that's typically going on with something in your inner thigh. If you have it more so on the outside, then it can be part of your outer quad, part of your hamstring, and then also like part of your IT band, okay? So all of those things are factors in the knee pain. Other things that you can do just for joint support, which I started taking these probably like when off and on since I've been about 30, is some glucosamine. This is one of my favorite supplements right now. It's a glucosamine, chondroitin, turmeric, and MSM. Like it covers everything. And it works really well. Like I don't take the full thing because I don't have any joint issues per se, but anytime like I do something weird with sprinting, I have a little nagging knee pain, pop this baby, double up on it, and then it's done. So I highly recommend this guy. You can get it from Amazon, and I think it's like maybe 20 bucks or so, okay? But again, can you exercise? Probably. So I've been working with a couple of clients recently with knee pain, and we are still doing our workouts. Our workouts have to be different. They're not going to be high intensity. We are actually doing things corrective exercise-wise, which I do have a lot of experience with their knee stuff. So we're doing things to strengthen their quads, like all four muscles in their quads. We're doing things to strengthen their glutes. A lot of times our glutes, or what we consider our hips, are really weak, and that will definitely give you some knee pain. So we're doing some banded exercise. I forgot to grab the band, but one of those like loopy things that people do to like try and grow their butt, it actually has a very functional and helpful thing as well to help you with some knee pain. So we work in a multifaceted way. We're trying to make sure that their quads are strong, but also not too tight. Make sure we're strengthening their hamstrings, making sure that we're strengthening their hips and their glutes. And that will typically help to alleviate a lot of their knee problems. This thing takes time. So it can be anywhere from, it can be 6 to 8 weeks. It depends on how bad it is, how long it's lasted, but they typically will get some sort of relief from it in as little as 4 if they are doing the work. So whew, that was a lot. That was a lot. So just to give you a quick overview, what should you do if you have knee pain? One, you need to go see your doctor, because you're going to have to just follow that track if you want to do stuff where it's not out of pocket. So see your doctor. They're going to give you the x-ray. They're going to throw you some anti-inflammatories. They're going to suggest physical therapy. Hi, Marianne. And that's all a good thing. So you can take up the physical therapy, or you can decide to go your own route. That part is up to you. If you do decide to go your own route, definitely, not flicking you off, definitely get a chiropractor, one that is really good at what they do, and one that doesn't always have to like crack bones to make adjustments. But that is going to be a good thing first and foremost to have. Establish a relationship with a very good massage therapist that specializes in neuromuscular or trigger point therapy, neuromuscular therapy, trigger point therapy, because they'll be able to really help work out the fascia. Or you can just do therapeutic or deep tissue massage. None of that Swedish, none of that relaxation, none of that. So stuff that's actually going to do work. Next up, attack things with your foam roller, working on some soft tissue release yourself, getting in some stretches. The stretching alone isn't going to do it. You will have to have some soft tissue stuff to help along with that. You can take some supplements. Turmeric is great for inflammation. And then the other thing that comes into this, believe it or not, is food. So if you're eating highly inflammatory foods, it is going to show up in your joints and in your muscles. I have had clients get like a significant decrease in pain from their joints by eating more anti-inflammatory foods. So cutting out some of the gluten, cutting out the sugar, I know, like all the fun stuff, cutting out the alcohol, and they absolutely feel a difference in their joints. This has gone on so much longer than what I intended, but I hope that it was helpful for you. If you have any questions, absolutely leave them below, or you can message me and we can, chit chat and figure out what you want with your plan. So the main take home thing is do not stop exercising, because you definitely need to work your body. You don't want it to just go to mush while you're at a physical therapist working on your left knee. Everything still needs to be incorporated. You can still do upper body stuff. You can still do core things. There's plenty of ways that you can strengthen your legs still without doing running or jumping or lunging or anything like that. But if you think that you're going to take out squats, that means you are never going to sit in a chair or on the sofa or on a bed again, which is not plausible. So don't give up squats. Just really learn how to squat the proper way. And I'm not saying add on weight to that, but squats are a part of your everyday life. If you sit in a chair and you stand up, you're doing a squat. And if you have stairs in your house, you are in some case doing a step up or a lunge. So don't allow somebody to tell you like you can't do that, because that limits a lot of the things that you're doing functionally throughout life. So message me if you want to. Comment down below if you have any questions or comments. And otherwise, I will see you lovely people later. Bye.